let's say like on the general medicine wards or in the ICU, um, there comes a point when a patient is quite sick. Maybe we have them on antibacterials. When do you start wondering, like, when do you start thinking if this is someone that could have invasive fungal disease? And then what's the current testing that we have available to us that we can start working this question up?
Great. Let's go inpatient. Okay. And let's talk about the risk factors in the hospital as we're rounding on patients and taking care of them. Who right there is at risk? There's three big groups there. One is that team that caring for patients receiving chemotherapy. So all our active, let's say, leukemic patients going through induction and getting, and their bone marrow is just slowly getting ablated as part of their treatment, and their white counts going down to zero. That person is literally at risk in the hospital for translocation of candida from their normal reservoirs. There's candida on the skin and in the gut. And so you worry that with disruption of the GI tract, with no immunity, you'll have candida move from inside the gut lumen to, let's say, the bloodstream. And so they're often at risk for candidemia. The other two big groups of patients are those who are undergoing, let's say, the highest risk is abdominal or gastrointestinal surgery. So again, you're just disrupting, that candida reservoir, the gut. You have diverticulitis, you have acute appendicitis, you have a small bowel obstruction. Someone's going to manipulate your bowel and you're going through resections and reanastomoses. So those individuals are at risk, one, for just mechanical spillage into the abdominal cavity. So they're at risk for abscesses that can end up being candida, or direct inoculation into the bloodstream. So surgery. And then maybe the last category that are the highest risk are those in the ICU. And that really stems from the skin being a reservoir for candida. And then what do we do in the ICU? Because it's required, because we need to use it, is we start putting in very large caliber lines, plastic lines that go from skin with a direct conduit to the bloodstream. So central lines, PICC lines, arterial lines for blood pressure monitoring. So all these lines, tubes for drains, these are all direct conduits into that patient. And Candida certainly can crawl down and adhere to that plastic material, grow on that plastic, and then disseminate deep into that person. So lots of studies looking at those three populations. And the ICU is one that's incredibly well studied. And so if I meet someone in the ICU, ongoing fevers, ongoing pressure requirements, unable to wean off, there's no obvious source. We've imaged, there's nothing really obvious to explain that. I think thinking about Candida is should definitely be on that differential. What can you send? Here's the problem. Our diagnostics for fungi are poor. So for Candida, a blood culture has a 50% sensitivity. There's lots of studies. Some go down to 10% sensitivity, some will say 80, but the average and what we teach is 50%. So you're missing a lot of Candida. One trick people like to do is then do repeat blood cultures. And so then at least you're increasing your chance of catching a candidemia. That said, I think if you have three sets of blood cultures in my practice and in my opinion, and none of them are positive, I think you've exhausted your blood culturing system to identify candidemia. Other things you can send are beta-glucan. And beta-glucan is a carbohydrate component that makes up the cell wall of Candida and many other fungi. So we tend to think of it as a pan-fungal marker. So it's not specific to Candida, but in the epidemiology of the ICU, Candida is your dominant fungal pathogen that you're concerned about. So if someone's beta glucan is elevated, that may suggest that they actually are suffering from a Candida infection somewhere. But I'd say for your average tools that we all would have available to us in the ICU to work up the possibility of Candida infection are multiple blood cultures and probably beta glucan are the two that we would all have available to us.